If you're dealing with incontinence or you know somebody dealing with incontinence, you may be surprised that it's somewhat hard to find specialists treating this condition, even though it's a super common problem. I'm Dr. Zeno. I'm a urogynecologist, and let's talk about it. This issue affects somewhere between 60 to 80% of women over the course of their lifetime, and yet there are fewer than 1,000 fellowship-trained people in this specialty. So why is that? You would be surprised to know that this actually goes back to the origins of our specialty, and I'm excited to get into that today, and hopefully that'll help you find the information that you need to get the tools you need and the treatment that you need. So have you heard of Anna K. Jackson? You may not be as familiar with that name, but if I say Anarcha, Betsy, and Lucy, that might give you a little more context. I was even surprised to know about this, that Anarcha was the given name for an enslaved woman who was experimented on in the foundation of our specialty in gynecology. She suffered from a condition called fistula. She underwent somewhere over 30 surgeries to kind of perfect this treatment or the techniques used to treat this condition. The condition, or fistula, leads to an issue called incontinence or bladder leaks. And even though it's not as common in the United States, it's one of the most common causes for bladder leaks worldwide. So here's a little backstory. Take it back to about 2016, 2017. I was still a fellow training in urogynecology. I'm at the American Urogynecology Society meeting. I'm sitting in the audience, and they're holding the last J. Marion Sims honorary lecture. This lecture was named after who many people consider to be the forefather of gynecology because of the surgical techniques that he developed, as well as some of the instruments and other contributions that he's made to the field. And a lot of those were developed in the context of treating women who were experiencing fistula. The lecture has since been renamed. It was renamed because there were several things going on at the time, recognizing that Dr. Sims was a flawed man. This lecture had my skin crawling. So the speaker basically was trying to give a defense for this lecture, why it was named the Dr. J. Marion Sims lecture, knowing that this was going to be the last lecture that we were holding in honor of his name. The lecturer basically took most of his information from Dr. Sims' texts. And for many years, this was the only information that we had about this topic. In Dr. Sims' texts, he, of course, in a way kind of glorifies his experience as a surgeon developing these techniques and trying to justify that he was doing these treatments to help women. The speaker went on to say that these treatments were being offered to the women who were suffering from this desperate condition, and they really didn't have any other, source of hope for treatment for this lifelong issue, unless if it doesn't get treated, as if these women were supposed to be thankful for being the subject of these experiments. What was missing from that conversation was the perspective of the enslaved women that were going through this. Unfortunately, they didn't have a voice in that lecture, and it's so important that we recognize that that has impacted the way we treat incontinence even today. So let me give you a little more understanding of how significant this issue is. If you're dealing with incontinence, what you're probably experiencing is potentially bladder leaks. It impacts your quality of life. For a lot of people, it impacts their social interactions, their sex lives, their perception of their own health and their self-worth. But imagine that you had the most extreme form of incontinence. And I also have patients like this where they have zero control of their bladder. And that's exactly, unfortunately, what happens with obstetric fistula. In obstetric fistula, it's a unique condition where women experience impacted childbirth or obstructed childbirth. Because of that, the baby or the fetus, as it's coming through the birth canal, is basically unable to pass. And this is an issue in areas where women have poor access to care. It's something I experienced as a trainee when I went to Uganda, and I actually had the opportunity to train at a fistula center. The main issue in that setting was that women didn't have timely transport to the hospital when they needed C-sections. When this happens, the impacted fetus's head or the presenting part gets stuck in the birth canal, and it gets stuck to the point that it causes the tissue around that to die, essentially. That's called tissue necrosis. Not only is this an unfortunate situation for that mother, because in most cases, or almost all these cases, the baby doesn't survive. They're often in situations where they're unmedicated, meaning that they don't have access to pain medication. And they're the further insult to injury is that they come out of all this without the child that they were anticipating. The downstream effect of all this is that tissue death often happens in the space or in the tissues between the bladder and the vagina. This causes something called vesicovaginal fistula. Now, this ends up creating a connection between the bladder and the vagina in a way that should not be connected. Because of that, there's basically nothing that's stopping the urine from coming out with any movement or at any time. So whereas with most incontinence, like stress incontinence, overactive bladder, urge incontinence, these are the things we commonly see in modern medicine when it comes to bladder leaks now. For people who suffer from fistula, they basically just have nothing blocking the urine from coming out, and it just leaks all day, every day. What we've learned now from modern texts, like a book I'm reading now called Say Anarcha, there's another book called Medical Bondage that has gone through this topic. We're learning that it wasn't just Anarcha, Betsy, and Lucy. It was Anarcha, Betsy, Lucy, and as far as we know, at least 10 other women who were enslaved at the time. Black women did not just contribute to gynecology as victims. They were women that became first surgical assistants to Dr. Sims and to other surgeons in the area. They were women who basically functioned as nurses and who, even before those surgeons arrived, were functioning as midwives, taking care of each other in their plantations. Now, you can imagine all these women were receiving these experiments or these surgical techniques with zero anesthesia. And the reason why that matters today is because, unfortunately, incontinence is still often not taken seriously. I think that's partly a byproduct of how we view it in our society. A lot of people laugh it off and say, oh, I leak a little when I cough, sneeze, or laugh, or isn't that just what happens when you get older, or that's what happens when you have children, right? The sad thing is that this is actually a very treatable condition, and it does become an issue when it's impacting your quality of life. Now, fistula is still an issue, even in the United States, but for more different reasons. It's not typically caused by birth injuries or obstetric fistula. In the US and in other developed countries, it's more commonly due to surgical causes, what we call iatrogenic, or sometimes we see it related to other inflammatory conditions, like in people who receive radiation in that area, or potentially in younger women who have issues like inflammatory bowel disease or Crohn's especially. Now, modern surgical techniques for fistula obviously involve anesthesia. It's important to make sure not only that the patient is comfortable during the procedure, but it's a big safety thing. So modern techniques for fistula include vaginal approaches, which is probably the most common, especially since these injuries tend to occur lower in the vaginal canal. But they can also be done laparoscopically or even robotically in cases where the fistula is more complex, and that's usually if the location is higher up in the vaginal canal or if it involves other parts of the body, for example, complex areas in the bladder or in the ureters where the pee is connecting from the kidney. Now, here's the important thing for you. If you're dealing with incontinence or you know somebody dealing with incontinence, the biggest takeaway, I think, from today is that fistula, incontinence, bladder leaks, very treatable conditions, and they are medical conditions. They're not cosmetic issues. There is unfortunately a push to bring awareness to this issue, and that's great. But the unfortunate part is that some people are using this as a time to solicit certain treatments that are not only evidence-based, they're not FDA approved. And so I'm specifically talking about vaginal lasers or other energy-based devices. Now, I do think they have their place. There is expert consensus that they're especially effective for certain rashes, like especially vaginal dryness or dryness on the outside, which is called lichen sclerosus. However, there is not strong evidence for their use in people dealing with bladder leaks. They're out-of-pocket treatments. And if an expert like myself or another urogynecologist can offer a treatment that is FDA approved, potentially covered through insurance, and effective, that is your right as a patient to know that that exists. The last thing to know about OV fistula is that this is an important area of collaboration for maternal health worldwide. As many of you may know, the US pulled out of the World Health Organization as of January of 2026. My hope is that we'll continue global collaborations on this issue, not just to improve treatments here in the US, but to improve the quality of life for women worldwide.